This episode is sponsored by TherapyNotes, therapynotes.com. Be sure and check them out and be sure and use the promo code Gordon, Gordon, and you can try them out for 2 months for free. Over 15 years ago, when I started my private practice, I had to learn a lot, and most of it the hard way, and I don't think you need to do the same. Hi, I'm Gordon Brewer, a licensed psychotherapist, and welcome to the Practice of Therapy podcast, part of the Psychcraft network of podcasts. Join me in this journey of discovery as we have conversations with other leaders and professionals in both the mental and allied health fields. Join us as we explore both the business and clinical sides of running a private practice. And welcome to the podcast. I'm Gordon Brewer, and this is episode number 285 of the podcast. Glad you're with me, and I'm looking forward to you hearing from Dr. Kevin Handley in this episode. And this is another topic that I don't think we've really talked about directly, but Kevin has done a lot of research into sleep, and that's really his area of expertise. And I think you're going to enjoy this conversation and really getting some new information that you can use not only with your clients, but also with yourself. I think one of the things that I know is a telltale sign of my emotional and mental health is as if I'm not getting good sleep. And so we delve into just kind of the research and some of the myths and all of that sort of thing around sleep and how it can affect us in our businesses, in our clinical work, and all of that sort of thing. So looking forward to you hearing from Dr. Handley. So before we get to him, I'd love for you to check out the podcasting workshop that I've put together. And if you'll go over to practiceoftherapy.com/podcast workshop, after a lot of conversations with friends and colleagues, they really encouraged me to put together this training, if you will, or this workshop. And I've put it together in a way that hopefully is going to be easy to digest. I've put it together in small bits, and the purpose of it is that it will take you through all the steps that you need to know in starting a podcast and why you might want to start your own podcast. So be sure and check that out, practiceoftherapy.com/podcast workshop. And the other thing I want to let you to know about, I've got a new cohort of my group practice focus group getting ready to start in July. And so if you'll go over to practiceoftherapy.com/focus group, you can find out more about that and apply to join the group. Now, this group is specifically for those people that have smaller group practices but are also insurance-based. And we've had a wonderful cohort through this first 6 months. The second 6 months is getting ready to start. I think some of those members are going to stay on, and then we also need some new members to join us just to talk about all the ins and outs of running a group practice, but also in the context of being insurance-based, because it's kind of a unique kind of thing for people. There's a lot of stuff out there about being a cash pay practice. Certainly that's a way to go, but there's a lot of us out here that really feel like both not only ethically, but also just based on the demographics of our areas, that we need to be able to accept insurance in our practices. So be sure and check that out, practiceoftherapy.com/focus group. And also, just to kind of backtrack a little bit, the podcasting workshop, I don't know if I mentioned, is going to be just simply an email workshop. In other words, you're going to get short little lessons delivered to your email inbox that'll only take you about 5-10 minutes at the most to watch, and you'll be getting one of those each day. And then at the end, if you want to dive in deeper, I'm offering a podcast academy that's going to be out there for us to just dive in deeper. So anyway, if you're interested, check it out, practiceoftherapy.com/podcast workshop. Okay, I've got all that out of the way. And here, before we get to my conversation with Kevin, I'd love for you to hear from one of the members of the PsychCraft Network and also from our sponsor of the podcast, TherapyNotes.
Hey there, Daniel Fava here, and if you don't know me, I'm the host of the Private Practice Elevation podcast, where I share online marketing strategies and interviews to help private practice owners attract more clients and scale their businesses. The Private Practice Elevation podcast is part of the PsychCraft network of podcasts, and I'm super excited to be a part of this network alongside Gordon and the great work he's doing. If you haven't discovered the Private Practice Elevation podcast yet, you can find it wherever you listen to your podcasts. I'd love for you to join me as we explore topics like building an effective website for your private practice, search engine optimization, content marketing, and copywriting, as well as my conversations with experienced private practice owners about scaling a practice, outsourcing, team leadership, and all things that will help you elevate your business and create the life you love. Be sure to check us out at privatepracticeelevation.com for resources and content to help you in your online marketing journey.
One of the keys to a successful private practice is having the right systems and processes in place to make things run as smoothly as possible. With a system like TherapyNotes, you'll have more time to spend with what matters most, your clients. TherapyNotes is a complete practice management system with everything you need to manage patient records, schedule appointments, meet with patients remotely, create rich documentation, and bill insurance right at your fingertips. Their streamlined software is accessible wherever and whenever you need it. Your clinical records will be secure with less paperwork, which means you can give a much better quality of care. It's the EHR that Gordon uses in his practice. Be sure to check them out today by going to practiceoftherapy.com/therapynotes, and be sure to use the promo code GORDON to get 2 months free.
Well, hello, everyone, and welcome again to the podcast. And I'm so glad for you to get to know today Dr. Kevin Handley. Welcome, Kevin.
Thank you. Appreciate it.
And Kevin is a clinical psychologist up in the Fredericksburg, Virginia area. And Kevin, as I start with everyone, why don't you tell folks a little more about yourself and how you've landed where you've landed?
Well, it's kind of a long journey. I've been doing this for a while now, but I guess I like to tell people I like to do a lot of different things. So I enjoy being a private practice clinician, but I also enjoy being a community college professor. And I try to mix up those worlds as much as possible. So after graduating from my internship, I moved to the Fredericksburg area with my wife. And we raised our family here since about 1997. And during that time, I've worked as a college professor. I've worked in community mental health. I've worked in hospitals, worked in private practice. And I've always just really loved giving psychology away. I was trained as a cognitive and behavioral therapist. And really from the get-go of my training and my internship, any opportunity I ever had to do workshops or to teach people things, and even on my internship where I was teaching medical residents, I've just always loved it. And I think that comes through in my community college teaching and in my practice as well. So,
yeah, I love that, because I feel like a big part of what we do as therapists, we have a term for it, psychoeducation that we call it. And, but I think a big part of it is just teaching people things that a lot of us in this field maybe take for granted and don't realize that it's something that probably the public doesn't generally know.
Absolutely. And it's certainly a huge part of cognitive behavioral therapy, but that's one of my, the reasons I'm so passionate about sleep, because it's so important, and it's amazing that people just don't know about it. Although it's gotten a lot more popular in recent years, but
Right.
there's a lot of people who just need some education about what healthy sleep looks like.
Right, right. You know what? As we were chatting a little bit before we started recording, sleep is something that has become really important for me over these last several years because I think, and I'm looking forward to hearing your thoughts on all of this. But I think there was a time period where we were all told that we have to push harder and get up earlier and do all these things and burn the midnight oil and all that sort of thing. And if you did those things, then that was a mark of success. But it's really counterproductive. So yeah. So how did you become passionate about this topic?
Well, I agree with you about the shift that's been happening with sleep, and that idea that we just need to go, 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 go. My argument is that begins in childhood. I always tell people, if you're a kid therapist, and I'm really not a kid therapist, but if you work with kids, particularly adolescents, your best bet is just to assume that they're sleep deprived to some point because of the way we run school start times, which is changing. You're starting to see a shift in that. I think COVID has had a lot to do with that. People have realized the benefits of maybe not running so hard and slowing down a little bit and sleeping. But I got into this kind of in an odd way. That it was probably 2007, 2008. I had 3 young children, all could fit in the back seat of my car, in car seats at that time. And people would often talk about bedtime battles and how difficult it is with their kids and so on and so forth. And we just never had that in our household. Now, the reason we never had that in our household is because my wife ran the show and she is very smart about sleep. And she basically had everybody on a schedule, which I didn't recognize it at the time. Honestly, I didn't pay that much attention to it because she had that locked in. Basically, she was running the schedule of the household around our children's circadian rhythms so that when it was time for bed, the kids were ready to go to bed, which is the best way to do it. People often talk about having to chase their kids around to get them to go to bed. And I always tell people in practice, we never want to chase sleep. We want to set up our life so that sleep comes relatively naturally, and it will if we do the right things during the day. So it was about that time that I had a client, I tell this story often, that we had a successful treatment for panic disorder because I'd specialized in treatment of anxiety disorder, still do. And he had a real bad driving phobia. And we had overcome that. And it was our last session. We were wrapping up and he was moving out of state. And this was before telehealth. So this is probably the last time I was ever going to see this guy. And we were talking about it. And at some point he said, "I'm so glad that I'm able to drive again. I just wish I could sleep."
Wow.
And I was, and how did I miss it? Well, I missed it because I never really asked about it. And at that time, I was operating under the assumption that a lot of therapists are operating under, which is still the predominant belief today, that if you treat the presenting problem, any sleep problems that are accompanying it will just resolve themselves. We now know that that's not true.
Yeah.
It's not true. So all those things kind of came together at the same time. And I just got really thinking about sleep, and I started researching it and found out, well, yeah, the treatment of sleep is really not that complicated. It's just that we're not talking about it. And then when I started asking my community college students, I'd often get, in community college, we get students who are a little bit older parents, things like that. And they're always talking about sleep. But then I started asking students in general. And today, when I asked students on the first day of class, because I give them a heads up, informed consent, we're going to talk a lot about sleep in our principles of psychology class.
Right.
Raise your hand if you feel satisfied with your sleep. And, maybe 2 people out of a class of 30, their hands go up. It's like, okay,
right.
So I teach y'all how to sleep.
Yeah. So what have you learned about how do we fix sleep problems, for a better way of putting it? I mean, it's I think I know I've had on and off battles with sleep over the years, as far as kind of the to be transparent here, typically one of the things you mentioned the circadian rhythms, and I've realized that if I don't go to bed when it's time for me to go to bed, my body tells me it's time for go to bed, and I push it through, then I have trouble going to sleep and then battle it all night long, or it seems like I battle it all night long. So what's your research teaching you?
Well, what research teaches us is we've got very effective treatments for sleep, and they tend to be very brief and focused. We can usually when I talk about sleep, I talk about sleep health, what healthy sleep looks like, which is applicable to everyone. And your sleep story is pretty typical. And insomnia is a little bit of a special case, but very, very prevalent. And so what we know a lot about how to help people sleep better comes from research on the treatment of insomnia, which is essentially figuring out how to help clients move their behavior in a way that it lines up with their circadian rhythms, doing the right things during the day so that they can fall asleep at night.
Mm-hmm.
And unfortunately, we confuse this and we make it way too difficult. It's a bit of a tricky thing because sleep is a biologically driven process. However, it's one that we as humans override all the time. So, let me get one more thing done. Okay. Or let me, get up in the morning to go to school or to go to work when my body is really telling me I need to be sleeping. Well, I'll just override that with an alarm clock. So how do we wake up well so that we have enough energy throughout the day and then fall asleep at night? This is basically what cognitive behavioral therapy for insomnia talks about. It's usually a 4 to 6 session protocol that happens over 4 to 8 weeks. And it is remarkably effective at helping people sleep better. And when I'm talking to clinicians about this, I tell people all the time, you don't have to become a sleep specialist. I mean, I've done hours and hours and hours of training and supervision and cognitive behavioral therapy for insomnia. But if, we can get people just asking our clients a little bit about their sleep health. People forget that the primary symptom or criteria for the diagnosis of insomnia disorder is a dissatisfaction with the amount or the quality of sleep. And so if we start asking people about sleep, which unfortunately we don't, then we have the opportunity to make a big difference, not just in the patient's sleep, but also in whatever they're coming to treatment for. That, and there's what we call a dose response relationship between how much you attend to sleep and how much better it gets. So I tell people, can you do something with your clients? Can you just ask them? You don't have to become a sleep specialist. But once you uncover a few things, then you might find something to work on in counseling, because a lot of people just don't know, right? Most of us have become so accustomed to being so tired all the time and told, well, that's just the way that it is. Or even worse, we wear it as a badge of honor, that they don't realize there's another way.
Mm-hmm. Yeah. Yeah. You said something, I wanted you to maybe repeat it. You said dose to sleep ratio. Is that what you said? Or how did you say that?
Yeah, I said there's a dose response.
Oh, okay. Yeah. Say more about that. I'm really curious about that.
Sure. So when we talk about sleep health, we're talking about things like regularity of sleep, right? Feeling satisfied with your sleep, right? Alertness, sleep efficiency, which is the amount of time that you spend in bed versus awake, sleep duration. The total duration of your sleep is probably the least interesting of the variables, even though that's the one that people obsess about. So if you can help people in any one of those areas, there's lots of different points at which you can intervene to help a person sleep. What research shows is that, if you can just intervene anywhere at all, number one, the sleep will improve, but also things that are associated with sleep will improve, most notably mood. And, we all have clients who come in for depression. And, if we can work on their sleep, we're also working on their depression. And so I tell people it's a great way to help improve your clinical outcomes is to just ask about and then do a little bit of work on sleep.
Yeah. Yeah. Is there such a thing as too much sleep?
There is. It's generally not something that people need to worry about. what tends to happen is that people, whenever we wake up in the morning, we have this transition from sleeping to awake, and where we feel a little bit groggy and we're slow to move, and we call that sleep inertia. And what people will often do when they're exhausted is they'll sleep an amount of time that's excessive compared to their typical sleep. And as predicted, they'll wake up the next day and they'll have this terrible sleep inertia. Some people compare it to being hungover.
Mm-hmm.
Some people it's just harder than others to wake up in the morning, depending on the individual and their biology. But what people often take from that is, see, I slept too much. I don't feel good when I woke up this morning because I got 8 hours of sleep last night. It's like, well, no, that might not actually be the case. You also need to differentiate, particularly in depression. Are you sleeping an excessive amount, or are you spending an excessive amount of time in bed? Those are two very different things. And for people with depression, it's usually that they're spending an excessive amount of time in bed. Insomnia usually accompanies depression. Hypersomnia can accompany depression, but it's the rarer form.
Right. So if you were to outline for us kind of I know everybody's going to be different in the way they approach this, but if you were to think about kind of a typical treatment plan for somebody struggling with sleep problems, what does that look like?
Well, what I always do is I tell people, think about the trans-theoretical model and think about how we work with all of our clients, right? We may have the best idea ever for what will help a particular client when they walk in the door. However, we also just have to meet a client where they're at. So you also have to do, I think, that with yourself as a clinician, is you have to do what you're comfortable with, right? And start with the simplest thing that you think that you're willing to do. So the first step is just to ask about sleep. Make it part of your intake. If you don't have a question in your intake packet about sleep satisfaction, that's the easiest thing to do, is to ask about sleep satisfaction. And then when I teach in my workshops on this for clinicians who don't want to be sleep specialists, but just want to get better at working with clients, I basically suggest 4 different steps. The first of which is creating your sleep space. And a great sleep space should be cool, dark, and quiet. I always tell people to start with that one, even though it's not probably the most effective way to improve sleep, but it's often one that you don't get a whole lot of pushback on. It's pretty easy for people to do. Can you get excess light out of your room? And most people are like, well, yeah, I can do that. Is your room comfortable? If they're not comfortable, then let's talk about that. And some simple changes to the environment can often have a pretty profound effect. The other next step is to create your sleep schedule, which is incredibly important. However, most of us grew up being told, go to bed. You got to sleep at this time. And they think about, I got to get up at this time. So when do I need to go to bed? And it gets you want to basically try to create a sleep schedule that's roughly in line with your circadian rhythm. And we tell people we don't choose a bedtime. The rule of thumb in the effective treatment of sleep is wake up at roughly the same time every day and go to bed when you're sleepy. And we help clients differentiate between sleepy and tired. People are tired often, for lots of different reasons. Sleep deprivation could be one of them. Stress could be another one, all kinds of different reasons. But sleepy means that what you were describing earlier, you get to that point where it's like, oh, there's the tipping point, and that's when I should go to bed. So we want to go to bed when you're sleepy. That's the sleep schedule. Right. Yeah. Unfortunately, when we've got kids going off to school at times in the morning that biologically they should be sleeping, they don't really know how to create a sleep schedule that works for them.
Right. Is it possible for somebody to change that up? I mean, if they, I guess for lack of a better way of putting it, tweak your circadian rhythms.
Boy, people try, but generally no. And that's one of the principles of working with sleep, is that sleep is a biological process that in most people, most of the time, nothing is broken. There's no biological problem. It's just that we've been trying to live life in a way that's inconsistent with the way our biology works. So the goal really is to bring your schedule in line with your sleep as much as you can. Now, the world is organized around early risers. It's not organized around night owls. And plus, we will change over time. So you can't really change your circadian rhythm that much, but you can, change your schedule a little bit to compensate for it or to accommodate it.
Yeah. I work with a lot of folks, or have worked with a lot of folks in my practice, with folks that work shift work. And that just is, my heart goes out to them, because it's just, they come in, they're exhausted, they're depressed, and, to me, it's obvious it's because they've got their days and nights mixed up, and, and having to push through at night and that kind of thing. Yeah.
It would be wonderful if you could take on a shift job and eventually your circadian rhythms would adjust to your behavior. Doesn't happen. So shift work are always going to have sleep issues. And the reason for that is because the sleep drive is really mediated by light exposure. And you just can't get enough of it when you're sleeping during daylight hours, unfortunately.
Yeah.
Right?
Yeah.
Just what keeps us up and alert and going, all day long. So if you have a sleep schedule where you're waking up at roughly the same time every day, you get exposure to light during the day. However, we're going all day. And so in the evening, this is when we need to start to wind down. And would be, step 3, which I call wind down wisely. We have unfortunately shamed people about using screens and turning off the TV, and people are trying to avoid light at all costs. That's all great if you can do that, but most people are not going to put down their phone. They're just not. The problem in the evening is too much arousal. And so if we can get clients to do something in the evening to reduce overall levels of arousal, so that it's easier to notice that moment when your brain goes, hey, time to fall asleep, then it makes the process of transitioning from wakefulness to sleep so much easier. For people struggling to fall asleep, winding down to reduce physiological arousal is a great idea. Not to chase sleep, but to reduce arousal so that sleep comes a lot easier.
Right. Yeah, that makes so much sense. You mentioned several times sleep satisfaction. How can people best measure that for themselves, do you think?
The easiest way is just to ask them.
Yeah.
Ask them if they're satisfied with their sleep. And what you're going to find are a couple of different answers. And then sometimes it requires a little bit more digging around. Some people are satisfied with their sleep. But they, if you think about the trans-theoretical model, might be in pre-contemplation where they're just not aware of the fact that they're sleep deprived. And a lot of people aren't. So they may say, yeah, my sleep is fine. But they may be starting to have some health issues as a result of not getting enough sleep, or they might be engaged in dangerous behavior like driving while drowsy when they're sleeping. Some people are satisfied with their sleep and it won't be 8 hours a night. And there's no set rule as to what people need. I always tell people it's 7.5 hours ish, depending on you, right?
Right.
If you're waking up in the morning feeling refreshed and you have enough energy to live a satisfying life and you fall asleep relatively easy and stress-free at night, you're probably going to have a high degree of sleep satisfaction.
Right.
Now, for people who are not satisfied, you'll probably find one of two things. One is that they have terrible insomnia. They know they have sleep problems. They don't know what to do about it, or they're on a schedule where they have no clue how to fix the problem. That's what therapy's for. We can help them, adjust all those things. The other type of dissatisfaction you'll find is when people complain about not being satisfied with their sleep, but they're suffering from something that we colloquially refer to as sleep dissatisfaction syndrome, or orthosomnia, we sometimes call it. But these are individuals who, because we've preached the importance of sleep so much, are now tracking it on their phone. And they're always, they wake up in the morning and look at their phone and it's like, oh no, I didn't get enough REM sleep. I didn't get enough. And your phone is not going to be an accurate measure of what your sleep quality is. And so they start worrying about their sleep. But when we actually assess their sleep in a reliable manner, which is using a sleep diary, having people record their sleep when they wake up in the morning, it's the gold standard for how we assess sleep. We look and you're like, well, you're falling asleep relatively easy. You're alert throughout the day. You're waking up refreshed. I don't think you have a problem. And so
Mhm.
sometimes they're worried about their sleep when they don't need to be.
Yeah. Yeah, that's helpful to know. I was just thinking I've got my Fitbit that I wear to bed so I can score my sleep. And, daggone it, I can't get above an 80, but you know.
Right, right.
Yeah. Right. Yeah. So
People see it and
that's
they say, well, do you
helpful.
need to know those numbers? I said, no, no. In fact, I
Yeah.
really don't want you looking at those numbers while we're working on your insomnia.
Right. Right.
Got an
So
online form you can fill out, or I got paper and pencil you can fill out. That's what we'll
right.
use. Right.
Right.
And they compute from that what we call the sleep efficiency. How well are they falling asleep, staying asleep? We calculate in nap time,
Hmm.
things like that. And so using a very simple spreadsheet or software, the treatment is pretty data driven in terms of
Hmm.
when you should be getting into bed, when you should be getting up, those types of things. It's clinical judgment as well, of course.
Right. Right. Well, this is fascinating stuff, Kevin. One question I do have is, if somebody, a common complaint that you hear from people is that I go to bed when I'm supposed to, but I can't turn my brain off. Can't
Mm-hmm.
stop thinking about things. Any tips on that for folks?
Absolutely. So worrying instead of falling asleep is one of the most common barriers to falling asleep. And so there's
Hmm.
essentially two strategies, two approaches to working with that. Number one is what I mentioned earlier. That's often a problem of too much physiological arousal, that the person needs to find a way to kind of wind down in the evening and or increase their activity level during the day, right? They're not
Hmm.
moving around enough. You have to sort of expend your energy during the day in order to have enough depleted energy at night to fall asleep. We go into details of that when I teach it, but that's what you need to do. You'd have too much physiological arousal in the evening. The other thing is just the problem of worry. And for that, you treat it like any other worry problem that whatever your methodology of doing that. I mean, I usually have people take more of a cognitive therapy approach. I have
Hmm.
people jot down their worries in the evening, and then engage in some problem solving around those. It's interesting that when clinicians will consult with me about this, and they'll say, my client's worrying in bed, I don't know what to do. I said, well, what do you usually do for worry? Oh, well, I would do X, Y, and Z. So why aren't you doing that here?
Hmm.
Well, this is a sleep problem, so that's totally different. Well, no, it really isn't. So yeah, whatever you find works for worry, do it. Help your
Hmm.
client with that.
Yeah.
Add on something to reduce physiological arousal, which can be anything that works for you and your client.
Yeah. This is great. This is great. I
Except using
love this.
substances. We don't want you
Yeah.
using
Yeah,
substances to.
right. Yeah, and that was another little thing I was thinking about was things like melatonin or sleep, sleep over the counter sleep medicines and that sort of thing. What are you finding around those things?
The research really doesn't support using any of those, certainly not over the counter sleep aids and not melatonin. There are
Hmm.
some specific cases in some children, particularly children on the autism spectrum, who, for reasons not quite understood, might benefit from melatonin. People who are jet lagged can benefit from the use of melatonin. But most over the counter melatonin that people buy, it's really not having an effect, and it's not an effective treatment.
Yeah.
And it's concerning because people will try those things because they're just trying to sleep and they're doing everything that they can think of. But they're, instead of getting what actually helps, they're spending time on something that's not going to help very much in the big scheme of things.
Yeah. That's good information. That's good to know. Yeah. Well, Kevin, I have to be respectful of your time, and this is I know we could talk about this all day long. This is fascinating stuff. Tell folks how they can get in touch with you if they want to find out more about your workshops and the things that you're doing and that sort of thing.
The easiest thing to do is just to go to my website, which is kevinhandley.com, KevinHandley. My workshops are posted there. They're all CE workshops. And I've got a couple of workshops. I'm always running workshops for sleep, but I'll run them on other things as well.
Mm-hmm.
One of the things I love doing, I love teaching. That psychoeducation portion, right?
Right. That's great. And we'll have links here in the show notes and the show summary for people to find those things easily. So, well, Kevin,
Excellent.
I hope we can get you back on the podcast again. This was a great conversation. And you've given me some things to think about with my own sleep patterns.
Well, do it for yourself and then do it with your clients.
Yes, sounds great. Thanks again.
Excellent. Thank you, Gordon. Appreciate it.
Well, I don't know about you, but this whole conversation has really gotten me thinking about my sleep habits and how I want to change some of them. And thanks again to Kevin Handley for being with me on the podcast. And be sure and check out his things. And you can find links to those resources that he mentioned in our show notes here. And check it out. So I hope to have Kevin back on the podcast. He was just a delight to talk to, and I really think he's doing some excellent work just around this whole phenomenon of sleep and how it affects us in our mental health and also in our lives. So check it out. And also, before we go, if you'll be sure and check out the podcast workshop. And I mentioned that at the beginning. And if you'll go over to practiceoftherapy.com/podcast workshop, you can sign up to start receiving that free resource. I don't know if I mentioned that it's free. It's a workshop that's going to be delivered to your inbox, and it's totally free. And you can go through that workshop and learn all the steps you need to know about starting a podcast. And also, if you have a small group practice that is also insurance-based, I'd love to have you join this next cohort, the group practice focus group. And it's a mastermind group. We meet twice a month, and we also interact with each other on the Circle platform and have just some really meaningful conversations and help each other out in just running a small group practice that's also insurance-based. I'd love to have you join me for that. And as always, big thanks to our sponsor of the podcast, TherapyNotes. And you can find out more about them by going to practiceoftherapy.com/therapynotes. And be sure and use the promo code Gordon, just GORDON, to try them out for 2 months for free. They're who I use in my practice, couldn't do without them. And it's an excellent platform, and they're constantly adding new features and new, as I like to say, bells and whistles that are just so helpful in making things run more efficiently and help with the automation in your practice. And be sure and check out, too, the Psychcraft Network and some of the great members that are there. So you can go to that by going to psychcraftnetwork.com. I've got too many URLs to repeat here. But anyway, folks, take care. Have a great rest of your week or weekend whenever you might be listening to this. And I'll be back next week with another episode of the Practice of Therapy podcast. Oh, and take time to follow us wherever you might be listening. Take care. You've been listening to the Practice of Therapy podcast with Gordon Brewer, part of the Psychcraft network of podcasts. You can find out more about the other great podcasts in the network by visiting psychcraftnetwork.com. And if you haven't done so already, please visit us at practiceoftherapy.com and get your free private practice startup guide, along with a lot of other great resources and webinars and free things just by visiting. Also, be sure to follow us wherever you might be listening to your podcasts. This podcast is intended to be educational in purpose and is not intended to give legal, accounting, or counseling advice. If you need a professional, find the right person for that.